Welcome to the What About Rural Health podcast, a place where research, policy, and real life stories come together to ask the critical question: what about the communities too often left behind? I am Chinasa, a development and global health policy strategist. And for me, this work is personal. From the village health workers struggling with limited supplies to the mothers walking miles for care, their stories shape the policies we need. Join me as we uncover challenges, spotlight innovations, and amplify the voices of those at the heart of rural health systems. Because every community matters, and it is time the world listens. Hello and welcome. You are listening to the podcast that asks the question too many forget. What about rural health? I am your host, Chinasa Imo, and together we are uncovering the stories, challenges, and innovations shaping healthcare in overlooked communities. Today we are going behind the scene to a part of rural healthcare that doesn't always get discussed. But honestly, it holds everything together. We are calling this episode Logistics for Life, and it comes under the theme Supply Chain and Emergency Response for Rural Healthcare. When we look at the full picture, that will be the systems, the people, and the everyday issues that shape health access in overlooked places, from rough and often deplorable roads to patchy electricity supply. I mean, if you have been to those places, you would understand what I'm saying. You could also see limited storage and slow movement of medical supplies and technology. It makes you wonder, how do rural clinics, dispensaries, health posts, or hospitals even have the basic supplies to keep the system running, however insufficient you might think they are? There is something, or rather someone, keeping the system running. Because in rural or hard-to-reach communities, access to basic healthcare is not just about the clinics itself. It's about getting life-saving medical supply to the last mile, keeping the cold chain running, and making sure health workers have what they need when and where they need them. It is also about ensuring that those clinics have vaccines, medicines, gloves, power supply, and so forth, and that those supply actually arrive on time. So logistics and the people who manage it makes this difference. My guest today has been at the heart of it all, walking through emergencies, navigating tough terrain, and making sure the system moves health supply to where they are needed, even when everything else feels stuck. So, if you've ever wondered what it takes to get medicine, vaccine, and essential life-saving supplies to rural communities beyond the grid, this episode is for you. Idrissa Rogers is a logistics specialist currently working with UNICEF in Sierra Leone. He is someone I've had the privilege of meeting during one of the most intense public health emergencies of our time, the Ebola outbreak in Sierra Leone. In 2014, I was serving as a humanitarian affairs and psychosocial officer with the African Union Mission posted to the Tonkolili district. My work involved everything from community surveillance oversight and psychosocial support to child protection and daily visit to families under quarantine. To do that work, I had to liaise with various UN agencies on the ground, UNMEA, UNICEF, World Food Programme, and so on, to ensure that families had what they need to survive, including food and basic supplies. That is where I met Idrissa, who at that time was working with World Food Programme as a logistics officer, making sure that food aid and essential supply reach quarantine households, families in need, and hard-hit communities. Even back then, it was clear how critical logistics is and how much heart, precision, and strategy it takes to ensure that life-saving supply reaches people in crisis. Since then, Idrissa has continued to bring that same drive and dedication, leading logistics effort from the front line. He has over a decade of experience in logistics and supply chain management and has worked across major emergencies, name them, starting from Ebola to COVID and other smaller disease outbreak in between. He has worked with Plan International and has also played a pivotal role in everything from shipment to fleet coordination to procurement to warehouse management to last mile delivery. And at UNICEF, he has served in different roles, including as logistic lead for the nationwide malaria campaign, helping to ensure life-saving mosquito net reaches communities across all of the 16 districts of Sierra Leone. And for those who don't know, Sierra Leone, some countries use county, but Sierra Leone uses district. So the entire country is divided into 16 districts. He holds a Bachelor's of Commerce, a postgraduate diploma in procurement, an MBA from the University of Sierra Leone, and he has continued to build on his expertise through professional training and advanced study. And most recently, he is pursuing an MSc in supply management and logistics at Aden University in Berlin, Germany. Congratulations for all of this. So from emergency response to long-term system building, from warehouse operation to community service, Idrissa brings deep knowledge, grounded experience, and quiet determination to one of the most critical aspects of rural healthcare delivery. So Idrissa, it's such a full circle moment to have you here. Welcome to What About Rural Health?
Thank you very much, Chinasa. That was brilliant. And I must say, thank you very much for having me. Well, I would say this is my first podcast, to be honest, and I'm liking it already with that brilliant presentation that you've done. So thank you for having me, and I look forward to the rest of the conversation that we're going to be having.
We should ring a podcast debut bell for you, like clang,
clang, clang, clang.
Thank you so much. I am so opportune to be the first person to bring you to a podcast then.
Exactly.
All right.
Yeah. Thank you so much. And I really appreciate that was really brilliant presentation you did back then. And I think you've already laid the platform for us to talk about so many things that are happening in this part of the world and to also share my experience so far. Thank you very much.
Thank you. Thank you so much. All right. So before we continue, let's take a quick break. If you are enjoying this conversation, don't forget to subscribe What About Rural Health on all podcast streaming platforms. We are on Spotify, Amazon Music, Apple Podcasts, Listen Now, and so on. And yes, we are on YouTube too. Your support means a lot. Please leave a comment, share, and most importantly, drop us a review. It helps others discover this important conversation and keep rural health conversation going. All right, back to the episode. You are listening to the What About Rural Health with Chinasa Imo. Let's dive into the conversation with Idrissa. So Idrissa, logistics management is no small feat. I mean, I live my personal and even I live by myself, and even just coordinating my own household logistics can be a lot. So how do you do this on a scale? What keeps you going? Can you walk us through what a typical day looks like for someone managing health logistics in the field?
Right. Thank you very much, Chinasa. As you know, when it comes to logistics and operations, especially in the humanitarian world, we are more like support staff to program activities. So whatever programs want to do, we are like the foot soldiers on the ground to make sure that activity is successful. I would say for a typical country like Sierra Leone, of course, we are in West Africa. Of course, we have a lot of challenges here, the country infrastructure, of course, people's perception to health services. Of course, there are so many challenges around corruption, as you may know, and so many other things. So when it comes to actually delivering essential health commodities and services, The challenges are many, but in the humanitarian world, if you have a good partnership, and of course, with the right working tools, and now that we have, of course, improvement in technology, I think we should be able to position ourselves well to make sure that we support program activities. So for a typical day, I will tell you, it is not easy. It is tough.
Mm-hmm.
There are so many challenges on the way, internally, externally. Most times internally, these are ones that you can manage, but externally, they come in different forms. And if you don't know how to navigate, if you don't know when to pull off the right shot, you either land yourself into a problem or probably delay supplies for logistics. So I would say it's challenging, but again, I would say it's something that anybody will love doing. So that's what I would say.
So
Yeah.
when you are mentioning internal and external challenges, and my mind just go to a lot of things, like from custom clearance to managing inventory to warehouse work to getting and tracking supplies to the field. How do you even begin to keep all of that moving? How do you do that?
Exactly. So, I've spent my career throughout the humanitarian world, and I've, like you just mentioned earlier when introducing me, I've worked with several organizations. I mean, international NGOs, the UN. But again, different organizations have different approaches and different patterns, So if I would talk about, let's say, for example, internal challenges and then internal setup in terms of service delivery. Things change. There are new tools now on the platform. Sometimes we as international organizations, we always have the right tools. We always have the right equipment. We always hire the right people. Okay. And we always innovate. We bring in new ideas, but most times those improvements, do not synchronize with partners, for example, government, which for me is one of the biggest partners, Sister organization could be okay because we are all trying to maintain the same standards. But then you can have all the tools, all the equipment, but if that is not being complemented when you move out of that comfort zone, then it becomes a challenge. So I would say this is something that I've seen across organizations. Some organizations, they act fast, some they act slow, some have different approach to solving problems, some don't. Some things that will trigger them will not trigger other organizations. So probably as a logistics person coming in or joining a new team, you might have some of these challenges to fit in. But then at the end of the day, it depends on open discussions, honest and open discussions. And then, honest and open discussions internally, and also trying to see how you can be able to deal with external partners. And when it comes to government, most of the time, it is difficult to put them under certain pressure to meet certain things because they have their own way of doing their own business. Yes. I remember at one time we were discussing system improvements. We were trying to see how we can bring in new systems on board and whatever. And then I asked the question like, okay, we are doing all of these things. We are trying to be good. We are trying to be perfect. But then most of these things that we are trying to implement can only yield results if the places that we are trying to roll it out are able to complement our efforts. Okay, and if there's a gap there, I think for me, that is one of the major challenges. And when it comes to government, when it comes to service delivery, it's a technical thing and it's a complicated thing, especially when you're dealing with government. It's a lot of politics inside. There's a lot of, sabotage, I would say. So for me, I think it's one thing that one has to have up there when you are actually taking up some of these roles. And for me, it has been challenging to some point, but for me, always I try to make sure that I say it, I bring it to the table, whatever it is. It can be a tough discussion. Sometimes people don't want to discuss it. While we are making all of these efforts and then people are not, complimenting our efforts, it might be they are the ones giving us the money, but it doesn't mean we are not accountable to the system. Yeah, so that again is something that is very typical in Sierra Leone setting, but I would say in a whole, as a Sierra Leonean and a logistics person in my country, I will tell you, I always find my way around to make sure that I manage that one and also share some of these challenges with colleagues.
Thank you. For sharing that. And, finding our way around is part of the innovations, because when you work in a place where challenge is the backbone of the day, you have to figure a way to, walk around and be innovative, be creative in ways that you get your job done and get things to the people who need it. And thinking about the people who need it, let's talk about the role of logistics in rural healthcare delivery. From your perspective, why is logistics such a critical piece of the puzzle, especially, in hard to reach areas of Sierra Leone?
Yeah, of course, when it comes to service delivery, one of the major things you have to think about is access. And what gives you access is, of course, logistics gives you access, because, like I mentioned earlier, we are the soldiers on the ground to making sure that things happen. When we receive consignments at the port, okay, we need to deal with so many people to make sure that it reaches the last destination, last mile. There's so many challenges on the way. A typical example could be, for example, let's say there is a shipment, okay, during an emergency. You have to look at what are some of the processes that you need to follow in order for you to deliver that thing to the last mile, to make sure that beneficiaries access the drugs. Because you can have the health professional there, but if the tools are not there, if the commodities are not there for the person to do the work, they cannot move. And for Sierra Leone, I would say when it comes to logistics, even the government don't rely on themselves. When it comes to that's a fair one, I would say. They don't rely on themselves to champion logistics. They would rather push it to non-governmental organizations to make sure that at least they play the coordination role and support role in the background, whilst you do the actual work of delivering, the commodities to the last mile. And of course, Sierra Leone is a tropical country. There's a lot of challenges. Most of the time, government just focused on the highways, the main roads, and the township, but where the problems are, for me, it's, not much concentration is paid there in terms of improving the roads. For other places that could be accessed through rivers or lakes, sometimes you have to rely on local partnership. Dealing with people at local communities to make sure that if in the worst case scenario, a supply could not reach the final destination, but at least it is kept somewhere where it is safe, whilst you try to find a solution. So for me, for a typical logistics, these are some of the key challenges, the terrains, and then, of course, local partnership has to be strong. Because at the end of the day, you can't be everywhere at any time. You just need to partner with somebody to make sure that things work out. And most of the time, these are things that are not formal. These are things that are not documented. There's a lot of things also you have to do in the background. I'm not saying illegal things, just to make it clear. There's a lot of workaround, that you have to do in the background to make sure that, okay, you should be able to focus, to say, okay, I want to move these things from point A to point B. But let's say the truck got stuck in the way. What would happen? Do you have contacts along this way? Who would you call? So as a logistics person, you have to be really, really open-minded, and then be able to focus accurately. And you should be able to also figure out what are the potential problems that will emerge, in any case. So for me, I think that's the kind of scenario that you will find in a typical day.
Thank you. Thank you so much. And I want to bring you directly to your malaria campaign. That's really a huge one. So can you take us behind the scene of that campaign? What were some of the major, challenges that you faced delivering that campaign, and how did you make sure that the net actually gets to the household that needed them the most?
Okay, that's a very great question, and I really learned a lot from that activity, if I would call it. So this was the situation wherein we were supposed to deliver 7 million bed nets across 16 districts, as you mentioned. And so it was like CRS. They were supposed to manage of course, the registration of the beneficiaries, make sure that this information is uploaded in the system. And I just want to talk about a system that they actually rolled out at that point, and it was a very good system. It's not kind of a logistics-based system, but it's a program-based system. But this is a system that I would recommend for any organization that is engaged in distribution of health commodities to beneficiaries. They call it the Red Rose system. I don't know if you've heard about Red Rose. Maybe that's the first time we are using it in Sierra Leone, but some other countries must have been using it. But it's called the Red Rose system, wherein beneficiaries are being registered through a mobile device. So which means somebody will show up at the beneficiary door, take their information, how many beneficiaries are there, how many people are in their household. So they will take all of this information and then they will upload it in the system, and then they will give the beneficiary a ticket with a PR code. So that registration slip is what the beneficiary will keep for the day of the distribution. So once that data has been populated in the system, it's like a dashboard. Everybody will see how many beneficiaries have been registered. So it is that information that will inform the process of delivery of the bed nets. So the role of UNICEF then was to pick up the bed nets from the ports, deliver them at the regional warehouse, at the district warehouse, and then to the final facilities. So I was the one. So that, in fact, that was the time I joined UNICEF as a logistics specialist to actually provide technical support to the government, because they were the ones who were providing the storage of the bed nets as well as transportation of the bed nets. So my role basically was to make sure that the business processes are well followed, and make sure that there is no bottlenecks or there are no challenges. Where there are challenges, I make sure that I flag it up with UNICEF and the government to make sure that everything goes smoothly. So that was how it went. But then again, like we keep saying about the challenges and government systems. And for me, that was where our system and our partner, especially the government, was tested. Because here is the situation. I know exactly how many bed nets are supposed to go to point A because I can see them on the dashboard. I can be anywhere. I can even be here at my office. So if I'm in Bo, for example, and I know 1,000 bed nets are supposed to go to, let's say, Kolbondo or Golan or wherever, then we were actually sending the bed nets out with a manual waybill. So which means we send out the bed nets with the manual waybill from the warehouse. I was there throughout the process, making sure that all the bed nets are sent to all the facilities, making sure that each facility has enough bed nets that is enough based on the registration outcome. And then at the end of the day, when those bed nets have been distributed, those who showed up to pick up their bed nets, automatically we would know that a certain number of people have showed up that pick up the bed nets. But again, one of the major challenges I have there was after the bed nets were moved to the locations and people signed in for the bed nets, they were supposed to come back. For example, you don't just send out a bed net. Of course, you send out the bed net with three copies of waybills. And then you need to get a copy of that waybill back, coming back to make sure that it was received. And for me, that was where the challenges were. And people were so reluctant, to make sure that these bed nets I mean, the return way bills come back, and then, compiling a report. There are some other things I as a logistics person, I will not tell somebody to meet those requirements, because these are standard basic requirements that anyone should be able to fulfill. So so at that point I realized that, okay, if we can play our own part, but then when it comes to especially the government or whosoever, I mean, people are reluctant to make sure that, the thing work out well. How are we going to make sure that this does not repeat again? There's nobody who is going to do a follow-up on that. There's nobody who is going to make sure that, okay, why is it that we do not have return copies of bed nets coming back? Because those return bed nets, they were not just going to be lying down idle. Some of them were going to be distributed also as routines, for medical services. So for me, it was a major challenges. And also storage facilities are not enough, especially in certain facilities. Sometimes you have to talk to the chiefs to make sure that they keep some of these bed nets. If they could not reach the final destination, probably it's as a result of transportation constraints, because there are not so many places you can take vehicles. There's so many difficult terrains. There are sometimes people have to carry them themselves. Sometimes you have community volunteers who actually will come to the aid and say, you know what, we are going to champion this, because at the end of the day, it is for us. So for me, those are real challenges, and also the willingness of people to do a good job. That is, for me, is a very critical thing, especially in Sierra Leone. People should be willing to say, you know what, we want to make sure that this thing happens and it is successful. But, within that cycle, again, and I would say, so many people will not take their job seriously. And you must have done everything. This is a situation wherein you have a truck that is going with a conveyor that is being hired by the government. So why do I need a conveyor when I've already contracted a transporter to take a certain number of bed nets to a certain facility? If there's anything missing, who am I? I'm not going to pay you, right? But then we went so far as even hiring a conveyor, because we don't even want those drivers to say, okay, I'm not educated, I don't know what is happening, I don't know how to, these things that we already know. But in the midst of that all, you will still have a problem. For me, I think with my experience, working in the logistics field and in this country, I think the willingness of people to do a good job is something that is paramount in logistics.
Thank you so much.
It's something that we should be able to look into. Yeah.
Thank you so much, Idrissa. This is beautiful. I like that you're sharing your experience, because these are things that we don't get to know. Like, we just climb on, there's not enough drugs, there's not enough bed net, there's not enough this and that. But nobody sits to wonder, what is the logistical constraint behind why we do not see what we're supposed to see in the health facilities when we need them. So we'll go for another short break, and when we come back, we'll dive more into the conversation. Do you have a rural health story that needs to be heard? Whether you are a health worker, a patient, a policymaker, or advocate, we want to hear from you. Share your story on our website. You go to www.whataboutruralhealth.com/stories and help us spotlight the realities behind the data. Someone from our team will contact you with details on how to get them published when you submit your story to us. We get this published in our newsletters, in our website, and every of our other social media platforms. Don't forget to subscribe, leave a review, and share this episode. Your support helps us amplify the call to strengthen rural health system. Until next time, I am still your host, Chinasa Imo. Let's continue to ask the question, what about rural health? Thank you very much, and bye.